In this video, we're going to review the medical, pharmacy, vision, and wellness benefits available to Mohawk Valley Health System employees who are members of the CWA Union for 2016. For 2016, you have two medical plan options, an exclusive provider organization plan and a preferred provider organization plan. First, let's take a look at the EPO. Here's an overview of some of the most common medical expenses. Keep in mind, though, that this is not a complete list of all covered medical expenses under this plan. See your plan documents for full details. First, note that because this is an exclusive provider organization plan, or EPO, there is no out-of-network coverage. As you can see here, some medical services are subject to the deductible. The deductible is the amount you owe for healthcare services covered under your plan before your health plan begins to pay. So, you pay 100% of the cost of these covered medical expenses until the deductible is met. Then, coinsurance kicks in for these services. For this plan, there is a $1,000 deductible for individuals. That means that you are responsible for 100% of the cost of any medical services that are subject to the deductible, such as inpatient hospital stay or outpatient surgery, until you've reached the $1,000 deductible. Then, your plan kicks in and you drop down to 20% coinsurance for these services. Coinsurance is your share of the cost of a covered service, calculated as a percent of the allowed amount for the service. For example, if the plan's allowed amount for a medical service is $1,000, and you are responsible for 20% coinsurance, then your coinsurance payment would be $200. For families, there is a $3,000 deductible followed by 20% coinsurance, but each member within the family has their own individual deductible of $1,000. So, for families, there is a $3,000 in-network deductible, but there is a $1,000 deductible per individual. You can think of it like an individual cap. Each person pays toward the deductible, and once any one individual reaches $1,000, like Tom has here, coinsurance kicks in for them, regardless of whether or not the family as a whole has reached the $3,000 family deductible. The rest of the family will continue to pay toward the deductible. What that means is that if one person is using the plan more than everyone else, they don't have to wait until the family reaches the $3,000 family deductible before their coinsurance kicks in. For covered services that are not subject to the deductible, you'll pay copays from day one. A copayment is a fixed dollar amount that you pay for covered healthcare. This is usually paid right at the time of the service. For a primary care physician office visit, you'd pay a $30 copay. For a specialist office visit, you'd pay a $50 copay, and a $35 copay for an urgent care visit. For an emergency room visit, there is a $150 copay. All preventative services are covered in full. There is also what is called an out-of-pocket maximum. The out-of-pocket maximum is the most you pay out of pocket on expenses like your deductible and any copayments or coinsurance during a policy period. Once the out-of-pocket maximum is met, your health plan begins to pay 100% of the allowed amount. So, you will never pay more than this out-of-pocket maximum in any single plan year. This ensures that health plans pay for significant health expenses, and it limits the risk of medical debt or bankruptcy for insured individuals. Note that this limit includes your deductibles as well as any copayments or coinsurance, but does not include your premium or any expenses not covered by your health plan. It also does not include any prescription costs because there is a separate prescription out-of-pocket maximum. This plan has a medical out-of-pocket maximum of $2,500 per individual. For families, there is an out-of-pocket maximum of $5,000 with a $2,500 out-of-pocket maximum for each individual within that family. Now, let's take a look at option 2, the Preferred Provider Organization, or PPO plan. Here's an overview. As you can see, there is both in and out of network coverage for this plan, but there are some differences in the costs for each. In this plan, some medical services are subject to the deductible. Again, the deductible is the amount that you owe for healthcare services your health plan covers before your health plan begins to pay. For this plan, there is a $750 deductible for individuals. That means that you are responsible for 100% of the cost of any medical services that are subject to the deductible, such as an inpatient hospital stay or outpatient surgery, until you've reached $750. Note that this deductible is combined for both in and out of network. For families, there is a $2,250 deductible, but each member within the family is subject to their own individual deductible of $750. So for families, there is a $2,250 in-network deductible, but there is a $750 deductible per individual. You can think of it like an individual cap. Each person pays toward the deductible, and once any one individual reaches $750, like Tom has here, coinsurance kicks in for them, regardless of whether or not the family as a whole has reached the family deductible. The rest of the family will continue to pay toward the deductible. What that means is that if one person is using the plan more than everyone else, they don't have to wait until the family reaches the $2,250 family deductible before their coinsurance kicks in. Once this deductible is met, you drop down to 20% coinsurance in-network and 30% coinsurance out-of-network for all covered medical expenses subject to the deductible. For covered services that are not subject to the deductible, you'll pay copays from day one. For a primary care physician office visit, you'd pay a $25 copay in-network. For a specialist office visit, you'd pay a $40 copay in-network, and a $35 copay for an urgent care visit in-network. For most out-of-network services, you'll be subject to the deductible and then 30% coinsurance. For an emergency room visit, there is a $100 copay both in and out of network. This plan has a medical out-of-pocket maximum of $2,000 per individual. Again, the medical out-of-pocket maximum is the most you pay out-of-pocket on medical expenses, not including premium, during your policy period. Once the out-of-pocket maximum is met, your health plan begins to pay 100% of the allowed amount. So, you will never pay more than this out-of-pocket maximum in any single plan year. For families, there is a $4,000 total family out-of-pocket maximum, with a $2,000 out-of-pocket maximum for each individual within that family. Pharmacy benefits will continue to be managed by Broadreach Medical Resources, or BMR. These benefits are the same regardless of which medical plan you select. For prescription drugs, there are 4 tiers: Tier 1 generic drugs, Tier 2 and 3 brand name drugs, and Tier 4 specialty. There's a $10 copay for Tier 1, $35 copay for Tier 2, $50 copay for Tier 3, and $100 copay for Tier 4 specialty. Just like the medical, there is an out-of-pocket maximum for your pharmacy cost. There is a $2,000 per person out-of-pocket maximum, with a $4,000 per family out-of-pocket maximum. Note that this is separate from your medical out-of-pocket maximum. If you and your family choose to use the MyRx pharmacy located at St. Luke's to fill your prescriptions, you can save some money. MyRx is a pharmacy located at the St. Luke's campus dedicated to filling the prescription drugs of employees of MVHS. Through MyRx, select generic drugs will be only $3, or the cost of the drug if it's lower than that. And you can get a 3-month supply of your maintenance drugs for only 2 copays instead of 3. You can even get some very inexpensive over-the-counter medications. To make it as easy as possible, there's a designated parking spot for quick MyRx pickups. And MyRx will even ship prescriptions through the mail for employees who want to take advantage of the savings but are unable to get to the St. Luke's campus. You can contact the MyRx pharmacy at the phone number listed here. Vision benefits will continue to be covered under your medical plan. If you are covered by either medical plan, the EPO or the PPO, then you will also receive vision benefits through that plan. So, you'll just need to bring your medical ID card when you go to the eye doctor. MVHS is proud of our wellness program, Better Health, Better You. All full-time employees have the opportunity to participate in the voluntary and confidential wellness screenings. These screenings will provide you with a full panel of biometric data and will help you to identify any areas of concern. It's as simple as that. The wellness screenings are conducted by Interactive Health. If you'd like to learn more or have questions about how to participate, you can contact Interactive Health at the number listed here. So what's next? Open enrollment for 2016 benefits will take place from November 6th through December 4th. You will need to enroll online through MyHR. You must log in and enroll or waive coverage no later than December 4th. If you have any issues logging into MyHR, contact Network Data Systems at the phone number listed here. If you choose to waive health insurance for 2016, you must provide proof of other coverage to Human Resources in order to receive the health insurance waiver stipend. We will be holding 4 benefits fairs in November. Here are the dates and locations. If you have any questions, do not hesitate to contact Human Resources.